really is, I'm very excited to be here with all of you, all 4,000 of you from all around the world. And I really applaud Dr. Don McKenzie for coming up with this great program that includes all the elements shown to decrease the risk of breast cancer recurrence. I think that's really good. Exercise, especially the upper body stuff, lymphedema, social interaction, and weight control, and most importantly, fun. Because if you don't have fun, it's not worth it. I know that you think maybe it was the chemo, radiation, surgery, targeted therapy that got rid of your breast cancer. I've been known to call it slash, burn, and poison. And indeed, I think it is slash, burn, and poison. But those treatments really only deal with active cells that are dividing. They're not taking care of the whole body and the whole neighborhood. In fact, you really need two things to get cancer. You need mutated cells, and there's lots of things that cause mutations, and you need them to be in a neighborhood that's egging them on. As long as you don't have the neighborhood sort of pushing them along, they could sleep and be dormant, and you really don't care, as long as they're not doing anything. And indeed, there's lots of things that can cause the mutation. You can inherit it, you can get it from viruses, you can get it from chemicals, and you certainly can get it from age. In fact, just living gives you mutations. It's sort of like, I think of it as dents in your car. You know, the longer you own your car, the more dents it has. And what matters is whether they're important dents or not important dents. Some are more important than others. Well, in addition, though, the dents are not enough. They need to be important dents, and they need to interfere with other things, and you need to be in the neighborhood. I don't know if this analogy is going to totally follow, but you need to be in a neighborhood that's really egging them on. And the neighborhood are the things that you can control. You can't control all the mutations. Some of them maybe, with eliminating radiation and watching out for some of the carcinogenic chemicals. But the neighborhood is exercise, stress reduction, social interaction, fun, all of those things that reduce inflammation and actually keep those cells, if there are any left, asleep and dormant. And that's really the important thing. And you can do it that way. I mean, we can really control cancer that way. I live in LA, and I think about the bad neighborhoods we have in LA, and one way you could deal with it is by trying to arrest every gang member that's getting involved with drugs and crime and putting them into jail. And that would take a lot of effort and a lot of, and would maybe be successful and maybe not. That's sort of what the chemotherapy, and all the rest of that junk is about. But in addition, you could clean up the neighborhood. You could clean up the broken windows. You could clean up the streets. You could change, give them something else to do besides the gang, maybe a band or Boy Scouts or football team or soccer. And that in itself would change, maybe give them divert them into something else. And not all cancer cells are going to be diverted. There's always some, like maybe Timothy McVeigh, who blew up everything in Oklahoma. Well, it doesn't matter what neighborhood he was in, he was going to be bad. And there's some breast cancers that are going to be bad no matter what we do. But there's a whole hell of a lot of them where we can shift the situation by changing the neighborhood. And what you're doing with the dragon boat paddling is changing the neighborhood. And for that, kudos, and I congratulate you. Now, in 1980, when I became a breast surgeon, there were no women surgeons, really. I was actually the first one on the staff in Beth Israel Hospital in Boston. And I was chief resident. Usually you get a job when you're chief resident, but nobody offered me a job because I was a woman. So I hung up my shingle and I waited. And the only patients that they sent me were women with breast problems. So the news media always wants me to tell a story about how I stood at somebody's bed, and my mother and my grandmother, and they were dying, and I decided to become a breast surgeon. No, it was sexism, really, that made me a breast surgeon. They weren't going to send me any guys with hernias. I'd have a knife next to the crown jewels, you know, it would be dangerous. So I saw a lot of women with breast problems, and they were not being treated very well. Nobody was explaining to them what was going on. It was really, don't worry your little head about that, dear. We'll take care of it. And in those days, in those early days, people would go to sleep to have a biopsy. And if it was, and they'd do a frozen section, and if it was cancer, they had an immediate mastectomy. So they went to sleep not knowing whether they would wake up with a breast. And you know how they found out? They were in the recovery room, and they would be wrapped up, and the surgeon would be long gone, and the nurses weren't going to tell them, and they'd look at the clock. And if it was 1 hour, it was benign, and if it was 3 hours, it was cancer. And that's how they found out. It was horrible. It was terrible. In fact, then they had Reach to Recovery, which could come visit you in the hospital, but you had to have your doctor, your male doctor, write an order saying that it wouldn't be too distressing to you to talk to another woman with breast cancer. So we've come really a long way. And at that time, when I wrote the first edition of the book, it really was, I got a lot of flack. I was going to say a lot of shit, but I'll say a lot of flack for writing it. Because I was telling, like, secrets that doctors didn't usually tell patients. I mean, people told me they used to carry the book in to see their doctor, and if the doctor turned pale, they would leave. That was a sign. But doctors really didn't like me because I actually said, we don't know all the answers. We don't know the best thing to do all the time. These are the options, and they didn't like that. Well, it's now in 6 editions. I just actually self-published the Spanish edition because I couldn't get a publisher to do it. The Spanish publishers are still saying, our women don't want to know all that stuff. But it's there now. You can get it. And things have changed. They've changed a lot since then. We have breast conservation as an option. That's really great. We discovered the BRCA genes as the first book came out. We discovered that there are different kinds of breast cancer, and that some of them overexpress an oncogene that causes cells to grow faster called HER2/neu. I always thought HER2/neu should be something you put on your hair. It sounds like that, but actually Herceptin has made a really amazing change for the women that are HER2/neu positive, who used to all die very quickly before when they had breast cancer. In addition, we figured out that you could, a variety of different hormonal things. In the early days, we only had tamoxifen. Now we have all kinds of other drugs to make your life miserable. Aromatase inhibitors, for example. And people who have metastatic disease are indeed living longer than they did in those old days. But they're still dying. I'm glad they're living longer, but they're still dying. And we can't let that happen. We really have to figure out how we